It's a pleasure to be with you, and yeah, sorry for being a little bit late. I mixed the time. Yeah.
No worries, no worries. We are happy to have you with us, and I think the word is yours. And as with just before with Abbas, I'll have the presentation. So you just said next when you are ready for the next slide.
Okay, great. So thank you once again for giving me an opportunity to share our experience and to give you a little bit insight how we live here. And yeah, so next please. So I will talk about Lithuanian hemophilia care, which is now a little. I will go back with the steps in the past, and I will touch the important steps that we made for setting up a good hemophilia care, and sharing our own experience how to be a host institution for other countries. So next. I haven't introduced, so I'm pediatric hematologist-oncologist. I work in Vilnius, which is the capital of Lithuania. And next, please. So Lithuania is a small country with just 2.7 million inhabitants. And here we have 192 persons with hemophilia. The majority of them, of course, with hemophilia A, and among them 49 children under the age of 18 years with hemophilia. So our hemophilia care is located in one hospital, which is a formal hospital. However, in two locations. We have different locations for pediatric patients and for adult patients. But formally, we are one unit, one hospital for all hemophilia patients. Next, please. So we have a very nice, I would say, virtual team for hemophilia care, because the hospital is very big, the biggest in our country. However, we have all specialists we need for the multidisciplinary approach to hemophilia patients. So it's me, pediatric hematologist. I have my very good colleague, adult hematologist. We also we have all the specialists on demand, like orthopedic surgeon, laboratory medicine doctor, medical biologist, geneticists, dentist, obstetrician, and all the other specialists that we need. And as I said, I call it virtual team because we all work at different places in the hospital. However, we have usually 1 per month or 1 per 2 months meetings, and the core members are hematologists, then laboratory specialists, doctor, geneticists, and sometimes physio. So, but the core members that we meet all the time, I have just mentioned. So we had good access to care. We have treatment reimbursed. We have availability of all therapies, including standard half-life products, extended half-life products, and also non-factor therapies for hemophilia A patients. Primary prophylaxis started from the young age, and we have regular comprehensive assessment, that is PK assessments for patients older than 12 years of age. We have very good joint status assessment done by physiotherapists, and all the other lab and clinical things that are done regularly. Next, please. So the past and the important considerations for setting up hemophilia care. So next, please. So we have started somewhere in 2007, and it's more than 10 years ago. And at that time, we had no accurate numbers of hemophilia patients in our country. We have low coagulation factor availability and also consumption. We had treatment only on demand for all the patients in our country. We have, of course, very unfavorable musculoskeletal outcome, and we still see it for the patients that are in 40s and 50s. We have delayed orthopedic surgery. We had no approach to convenient home therapy. We had no laboratory diagnosis of inhibitors and all the sophisticated labs that we need today. And we also didn't have access to immune tolerance induction. So this is the point where we have started. Next, please. And how we started. So first of all, the doctors that were dedicated and that were interested in coagulation disorders, they said and they decided that we need to start with the Baltic guidelines, not Lithuanian ones, but all for the three Baltic countries. It means Lithuania, Latvia, and Estonia, which that are even smaller countries than Lithuania. So we decided that we need to have Baltic guidelines for the care and treatment of hemophilia patients. And from that, because we knew what's going on outside our country, especially in the Western Europe, we felt that we also need to start with that I mean, that are the recommendations in the world, so we need to do it somehow in our country. So also at that time we had a very good support that we had principles of hemophilia care outlined in Europe. And I mean, these were probably our decision, but also good papers and positions from the from other countries, I mean, to show to our authorities. So next, please. And we also created our objectives that we need credible database of Lithuanian boys and all population with hemophilia. We needed, I mean, we needed these numbers because we wanted to count and to show for the authorities how much we will need for the future if we want to start modern treatment like prophylaxis. We also set the objective to analyze the incidence and also to analyze annual consumption of clotting factors, so also to know what we need and what we will ask, and to start prophylaxis in children step by step with them, and later introduce treatment outcome measures. Next, please. And so this is a long-term commitment that have started in 2007, as I said, and we had a very strong collaboration and still have with the Patient Society. We did it together, clinicians and Patient Society. We communicated with the health authorities, and in addition to this, we also had to educate patients because it may seem not understandable, but it was like that patients didn't want to accept prophylaxis or didn't want to have modern treatment, despite we knew this is the best treatment for them. So during these 2 years, we communicated a lot. We wrote a lot of papers and lot of letters asking to do this and to allow us to start prophylaxis. And finally, we got it support from the Ministry of Health that allowed to prescribe hemophilia patients instead of 3 single doses to have 10 single doses. That was the first step. Next, please. I would not go in the details what we did, but probably these were the main steps and key considerations to be a strong conglomerate, I would say, clinicians and patients assigned to have the same direction, to know what we need, yes, and these guidelines that were also adapted from the European guidelines and dedicated persons, but that were the key factors probably establishing and going further and being at the point we are now. So as I said, also help from Haemophilia Patient Society, not even help, we are strong collaborators. also healthcare professionals working in coagulation field, and also, of course, industry support was also very important to us. So next, please. So we also, during these years when we are going up and up with setting up Haemophilia care in Lithuania, we also had a very nice experience with the NovoNordisk Haemophilia Foundation project. As I said, we started prophylaxis, introducing step by step a lot. Of course, I didn't mention we have had a very big also support and financial support, enrolling the patients into the clinical trials. I mean, it was like a bridge, not to start prophylaxis for all the patients, but to start for some of them. Then the others were enrolled to the clinical trials, and then after 10 years, everybody can have prophylaxis. So it was easier to extend this time and not to ask so much money from the authorities at once. So next, please. So after that, we had very nice two projects with NovoNordisk Haemophilia Foundation that are also inspired by hemophilia patients, because they knew they need physiotherapy, especially those who didn't receive prophylaxis from early childhood. So we felt that after having prophylaxis, we need strong physiotherapy care for our patients. So we had two projects for the establishment of physiotherapy care in Lithuania, and then we wanted also to spread our knowledge to the northeastern region, and also to strengthen physiotherapy care in these countries. Next, please. And after that, in 2013, we got a formal recognition of centralized hemophilia care by first of all by our hospital authorities. They acknowledged that hemophilia is a very rare disease. Of course, it's nothing new, but acknowledged that that it's good that we are a center and we can care for them, and so we established coordination center for hemophilia and coagulation disorders at the hospital I mentioned, and also we were certified by the European Hemophilia as a European Hemophilia Comprehensive Care Center by the EUHANET project. Next, please. And probably I can say that with going this way and having this all with us, we are ready to share our expertise and knowledge and experience with other countries. Next, please. And how to become a training institution for other countries. Next, please. So first of all, I would say that a dedicated hemophilia team is a must, of course, and knowledge and expertise in the field is also a must. And you gain this knowledge by going outside to the conferences, by communicating with the experts also outside, but also by doing your own guidelines or setting up what is best for your country. And also, I think it's important willingness to host other countries at your place and share the knowledge, because I think it's a very nice experience and big honor. And also strong connections and same directions with Hemophilia Patient Society, which we still have, and I think we will have, because you know, there are so many events we do together, and so many countries, they also join our society and they communicate. And sometimes even, I think some countries want to come to my center, not because it's me, I mean somehow, but because the patient society may be recommended also. So next, please. We had two already countries, Azerbaijan that was previously, and recently we have a doctor and a nurse from the Western Georgia. And you know, when you have the center and you have these patients, I would say there is nothing more than, first of all, you just do your job, everyday job, and that's it, and they can follow. That is the first. I mean, when you have knowledge and expertise, it's easy to do. So our focus was introduce hemophilia care system in the country, because I think it may be different from country to country. To follow up everyday routine, introduce multidisciplinary approach, because as I said, we have a lot of experts on demand. Show shared decision making in hemophilia care, which is very important in the 21st century. To talk with the patients what is best for them. Introduce latest developments in the field of hemophilia, because when you have my center has experience in the clinical trials and in the newest therapy, so I think it's a good to see for the countries that they are coming for the training, and also introduce specificities of participating in the clinical trials, as I mentioned. So next, please. And my personal view and advice to have or to be a host for the other countries. So I think it's be proud of what you do. I'm very proud. I like what I do, and I think, and I want to share what I know and what I learned during these years, and be dedicated, and also very important, have a nice and dedicated team. And yes, the nurse and the other doctor, adult hematologists, were very, very close, and we know from half of the ward what to do. So next please. And with that, I would like to thank you for your attention, and would be happy if you have questions. So thank you.